This is Caring for Special Populations, Role of Healthcare Providers when Caring for Incarcerated Individuals by Carrington Jones. Who are incarcerated individuals? The correctional system has several different branches. A person can be tied to corrections while being on probation or parole, where under supervision they are still being out in the community. However, a person that is incarcerated is typically charged with a crime, then housed in either a county jail or state or federal prison setting, which then they are locked away from the initial community. Most correctional facilities have a diverse makeup of inmates being housed, including working professionals, parents, spouses, and even well-known entertainers. However, majority of the incarcerated population is made up of people from a lower socioeconomical status. White males normally have a lower incarceration rate, while black males are 7 times more likely to be arrested and charged. There is a stigma associated with working in a correctional facility, and most people believe that their safety is greatly compromised in this specific work setting. Because this environment is viewed in such a negative light, there is a huge shortage and high turnover rate when it comes to healthcare staff in the Department of Corrections. In fact, one of the biggest barriers when it comes to quality of care for patients while incarcerated is the increased ratio of medical staff to inmate population. Special considerations while incarcerated. When working in such a high acuity environment, there are special considerations and protocols that employees must abide by. Patient safety is the most important aspect when caring for incarcerated patients, just as it would be for patients of any other setting. Healthcare staff are trained to be meticulous on monitoring for small details of change behaviors or daily routines. Staff must also gain self-defense training, seclusion and restraint training, and even advanced rescue training in the event of a possible fatality, such as a drug overdose. Incarcerated individuals may begin to feel limited when it comes to their personal or healthcare needs based on their current living situation. Healthcare staff have a duty to make sure incarcerated individuals understand that they have the full rights, privileges of any patient, no matter the circumstances. If a patient is chronically ill and cannot be treated in-house, they do have the right to be referred to a specialist for further evaluation. Incarcerated individuals have the autonomy to choose their preferred diet and purchased commissary food choices. In the event of an inmate reaching the end of life, they do have the right to advanced care planning and hospice options. Healthcare disparities while incarcerated. There are several documented studies that reference the lack of resources and overall funding for correctional facilities nationwide. Lack of resources and minimal funding create a difficulty when attempting to deliver quality medical care. Without proper materials, that could leave incarcerated patients with the disadvantage of having several untreated acute and chronic concerns. Inmates may begin to feel insecure or even embarrassed following the crimes they've committed. This personal apprehension may lead incarcerated patients to feel as if they are being misjudged or mistreated by facility employees, including those of the healthcare staff. If a patient does not feel comfortable with the healthcare professional, or if they feel as though their rapport with staff has been compromised, they are less likely to be forthcoming about their health concerns. Attempts at building a therapeutic relationship may be difficult with this population of patients. Providing culturally competent care to incarcerated individuals. Healthcare providers have a duty to practice ethically. There are several ways to incorporate specialized or culturally competent care into your work ethic for incarcerated individuals. Some of the ways that you can show competence while caring for inmates include referencing their preferred pronouns when speaking, calling them by their correct or preferred name and not by their assigned inmate number. Although interdisciplinary staff is able to access incarcerated patients' personal information, including their criminal record, it is best practice not to do so, as this may unconsciously create a bias toward the inmate. Incarcerated individuals may express feelings of many different kinds, and it is appropriate as a healthcare professional to listen to their concerns, offer empathy and assistance when applicable, and not insert your personal opinion. Be very diligent and thorough when assessing the well-being and mental status of incarcerated individuals. More than half of the population of incarcerated individuals have a documented mental health diagnosis. Depending on the circumstances of their sentencing, inmates can rapidly decline mentally, emotionally, and physically, and the healthcare staff needs to be proactive in their treatment efforts. Personal experiences of culturally competent care. In the past, I have been assigned the nurse to an incarcerated individual with a terminal illness, which was stage 4 metastatic bone cancer. Collectively, the interdisciplinary team made efforts to assure that this patient was being treated fairly and with compassion. Some of the things that were done as a nurse to assist with this particular patient were assisting with ADLs, whether it be brief changes or even feeding assistance. When the patient became too fatigued to ambulate independently, staff will offer assistive devices for support or even take the medication to the patient's bedside in their cell. One of the most important things healthcare staff did in support of this sick inmate was hold informative meetings with the incarcerated individual and their family to discuss end-of-life choices and comfort care measures. There are resources for further learning. If you are interested in more information about incarceration or incarcerated individuals, there are resources available for people who want to learn more or get involved. You can apply for per diem or internship work at your local county jail to gain insightful or hands-on experience. Independent research can also be done right from your computer by visiting your specific state's official government website for Department of Correction. Also, the Center for Disease Control website is another great resource that updates frequently regarding healthcare resources for incarceration and incarcerated individuals.